The closest thing we have is the earned income tax credit, which goes to some families, but for not very much money, and most families don't access it. We also have, in most countries, paid parental leave. This is often organized so that both parents can take a leave. The closest thing we have in the US is that a few states have a paid leave. The only countries that don't mandate maternity leave is the US, Lesotho, Liberia, Papua New Guinea, and Swaziland. So around the world, paid maternity leave is a norm. Most wealthy countries also have publicly subsidized child care for toddlers and for kids 3 to 6. The closest we have is free kindergarten for 5 to 6-year-olds, and Head Start for a very small segment of the population. Countries in the European Union spend about $4,500 per child per year on early childhood education. The US spends about $2,400. The other kinds of policies in place are funds for single parent households, for housing allowances, for books, for other costs associated with parenthood. In the US, facing this lack of support, working parents face really grave inequalities. It's up to parents to try to solve these issues. We need money to raise kids. We can't take paid leaves. We can't access publicly subsidized childcare. These are really enormous issues for all parents in the US, but particularly for poor, working class, and lower middle class parents. Despite having few supports for working parents, and because salaries are relatively low for all but the wealthiest families, we still see very high employment rates in the US. Before the pandemic hit, 70% of partnered mothers and 77% of single mothers with kids under 18 were employed or looking for work. We work because we have to. Because we are single parents and there's no other money coming in, or even if we're partnered, because one income can't swing what we need to pay for. Women in the US work, and we use that pay to cover the expenses associated with raising kids. But we pay penalties in our wages. Mothers in the US tend to be paid less, controlling for all the other things that explain wages than childless women. Even though mothers have higher and higher levels of education, greater and greater work experience, we continue to earn substantially less than our colleagues without kids. In countries that provide paid leaves for parents and childcare, this motherhood penalty goes away. In addition, some women have to leave the workforce when they have a baby because there's no one else available to care for a newborn, and there's no affordable childcare for babies. We know that in countries that provide paid leaves, women return to employment and maintain connections to employment, less likely to end up in dead-end jobs. These issues are exacerbated for women of color, particularly Black, Indigenous, and Latino women, who are often paid less or pushed into jobs that pay less. They tend to be worse for women with disabilities, women who are immigrants, and women who are not documented. Some women are lucky and work for employers who provide paid care leaves or childcare on site. It's a very privileged few that have access to these supports. They are mostly white, highly educated, and upper middle class workers. These policies do tend to have a positive impact on working families, but they touch very few families. Thus, we sacrifice in ways that are painful. We work swing shifts to cover childcare. We rely on neighbors and family members to step in. We find low-cost childcare and pay for what we can. At times, we have to leave children at home while we go to work. Childcare costs are incredibly expensive in the US because good care costs more than parents can afford on their own. Just as it wouldn't make sense for each parent to pay for schooling for their children, it doesn't make sense for each parent to pay for childcare. Salaries are not high enough to cover these costs, And we need these children. We need new generations of workers. All of this has been clearly exacerbated by the pandemic. Suddenly, it's visible to everyone what an important role childcare in school has had, not just for educating and caring for kids, but allowing parents to work and financially support their families. Less than half of all parents can telework, mostly those with college educations, and even those who still can are balancing their work with the needs of children. Our goals going forward have to be to prioritize investments into supports for working families, including care. My research focuses in three key arenas: employment, wages, and poverty. I believe that to create gender equity, we have to invest in care in a variety of ways. We definitely know that publicly subsidized childcare is key. It's the most consistent measure that affects mothers' employment, their wages, and helps them lift families out of poverty. Publicly subsidized childcare is particularly powerful for poor women and single women who cannot pay for childcare from their meager salaries themselves, but it actually lifts all boats. It helps all working families. I also believe paid leaves are critical. We have to create a shift in thinking of care as necessary, central to our economy, and providing paid leaves to support that care keeps working mothers connected to employers. That's it.
Wonderful. So what would you say, I know that your research doesn't specifically focus on COVID right now, but as sort of looking at what you just said and possibly personal experience as well, where do you see sort of COVID fitting into this?
I think COVID is having a really scary effect because what it's doing is making it less and less possible for women to maintain employment. There are not the kinds of supports in place we need. So we're probably going to see a real dip in women's employment. It's already starting in a number of sectors. We are likely to see much raised poverty rates for families with children. And when children grow up in poverty, it has dramatic effects over the rest of their life courses. So it's a crisis. We need a federal government that can step in, that can provide the support to keep families going and to keep women connected to jobs. But we aren't getting that.
I agree. Rebecca, so I think that question also ties into what your work has been doing. And I think Joya gave us a wonderful preface to sort of the unfortunate lay of the land in terms of the challenges and ways that mothers just really aren't supported culturally, financially, and through various supports that could be there that other countries are offering. How does that tie into the research that you've been doing so far? And please feel free to introduce yourself first.
It wouldn't be a Zoom call if you didn't forget to unmute yourself when someone asks.
I also forgot to record the first 5 minutes of this presentation. So you know what? We're just going to keep rolling with it though.
So thanks so much, Katie, for this invitation. So my name is Rebecca. I'm a public health researcher, and I look at social determinants of health, so specifically in the areas of income and food security. Importantly, one of my main interests is in the social policies that address those determinants. So my position at the moment is with the BC Centers for Disease Control in Canada, where I live. Where I work on several projects related to income and food security. But in the last year, and really relevant to this conversation, had a fellowship at Stanford's Basic Income Lab, which is a research hub that's connecting people working on the ground in advocacy and in practice with researchers around a universal basic income. And we've recently released 2 tools that I'm really happy to share and that I think could be useful resources for people if they have a question or interest in UBI. One's a synthesis report that I led on the global evidence base of policies that share features with UBI. So these are programs or policies which are in cash and not tied benefits that are have no strings attached and that are provided somewhat universally, although not always completely universally. And the other, which I'm really excited about, which just came out a few weeks ago, is an online map that organizes all of the main themes related to COVID, everything from gender to democracy to race, among others, and has comprehensive summaries on each and also show where they connect. So we can start to make some of these connections about how a UBI connects to some of these issues that Joya referenced around caregiving supports and gender and race, and how we participate kind of in our communities. And I also note before starting and getting into some of my research that while I'm an ardent and firm advocate for the overwhelming evidence of income as one of the most important determinants of health, that I'm neither a supporter nor opponent of UBI specifically. So I think there's many kind of policy iterations and options that can get us to a more equitable society, and really see my role in this space as sort of finding and synthesizing evidence from similar programs so that people can make their judgment about that as a policy response. So in relation to my own research, Katie, what you asked, so I think earlier this year it became really clear, as Joy has already raised some of these issues, that measures to mitigate transmission of COVID, while of course very necessary. I'm a public health researcher, so I'm absolutely an advocate for those types of measures, but they've had really severe consequences on social determinants of health, or those social and economic conditions, which we have extensive research to show are the most important determinant of whether we live healthy and whether we live well lives, like income and employment. So at the time, I'd been working with colleagues on research looking at the health impacts of the earned income tax credit. Joya referenced this one policy. I completely agree with all of the pitfalls it has, but it's also a very interesting policy for us to look at, to think about what types of impacts it would have if it was more universal, and if benefits were more generously applied. And it's been of a lot of interest, I think, to those of us in the basic income community, because it does tell us something about the outcomes we would expect from a basic income. So for those who aren't familiar with the ATC, it's an amount that varies based on income and family structure. It's an in-work tax credit, so you do have to have income earned to receive it. So as one example, a household with 2 or more children with a working parent making around 15,000 would qualify for around kind of 4,000 in tax credits. So for households at the lowest income levels, it can make up a significant portion of their after-tax wage income. And the largest population of those EITC recipients are single mothers. So it is a kind of quite a lot of interest, I think, to this conversation. So we had been doing a lot of research around the EITC and health with COVID and the impacts on employment and income that I referenced. We shifted our focus more to the employment dynamics of COVID, with a specific question about how employment changes could impact on people's eligibility for the EITC, considering what an important anti-poverty tool this has been for families. And from those results, we see some really worrying trends, and I don't think these will be of particular surprise. As we've seen across many areas related to social and racial and gender equity, COVID's just exacerbating and amplifying the issues we already had in our employment sector, as it did with, trends or troubling trends we have in our homes as well. You certainly don't have to look far to find those stories. I actually think there's been some really solid reporting during the pandemic that's focused on inequities of who have lost work and who has been unable to access supports. But our analysis really confirmed those stories at a larger scale using data from the current population survey. So what we found is COVID has disproportionately impacted workers who are already vulnerable in the wage labor sector. These are workers in sectors where jobs are typically lower wage, where they are part-time, and where work is precarious or less predictable. This is also a population who, because of low wages, are least able to weather an economic crisis. So they don't have the savings when a crisis like COVID hits and they lose employment to be able to keep meeting their needs without some kind of support kicking in, which it is not done across the board. To put some numbers to that story, so total employment loss between February and April was around 13% across all sectors and industries, so as a general whole. But the percent loss in employment for sectors with the lowest weekly earnings. So these are the 3 sectors where in that kind of scope of all jobs, the earnings are lowest. Employment loss comparatively was 36% in food preparation and maintenance, also 36% for personal care, and then 17% for building grounds and maintenance. For personal care in particular, this is an overwhelmingly feminized profession. 77% of those in personal care are women. And to put those lower wages in perspective, a health aide in the United States makes between $20,000 and $30,000 a year, well below the median income of $60,000. So I think what really worries me also is that in the recovery and as restrictions have loosened, we're seeing the biggest gains for workers with higher wages. So while low wage workers are seeing really small movement, we're just not seeing those hours regained. Mm-hmm. And given what we know about pay inequity and that it's lower wage workers who are regaining their hours the slowest, this is a huge hit for women, and especially for low wage women who are in the workforce. So to come back to that idea of the EITC and why we made the connection between those 2 things. So because of the significant overlap between sectors where there's been the greatest amount of employment loss, these are also the sectors that account for the highest proportion of EITC recipients. So this made us very concerned that families could face a double hit of economic hardship, first from employment loss, so loss of wages from employment, and then again from benefits loss at tax time. So we face a bit of a data challenge at the moment because of when these data get released and when we can kind of look exactly at how these dynamics are playing out between wage loss, the money people receive through support like CARES, and then the EITC. But we still think this data is a really troubling signal and speaks to the need for reforms that build, improve upon, and deepen our social safety net. And we see the EITC as one kind of building block or starting point where with expansions, you could get a bit closer to a guaranteed income.
So before we move to Aisha, a question for either Joya or Rebecca here, as sort of perhaps a lead in there, is why or do you see linking benefits to waged work as being problematic? Certainly Clinton's plan shifted a lot of that, but do you see that as being problematic? And if so, why?
I'll try to give this a go. When we emphasize work as the source of benefits, that means that anybody who can't access work doesn't get benefits. So if there is care that needs to be done within the home, if someone is disabled, there's just lots of reasons why work isn't necessarily the best way to approach it. And most countries do have safety nets to address that. The US just has a very limited one.
Thank you. And that, I hope, perhaps leads into some of what Aisha is doing, in the sense that benefits are not necessarily linked directly to work. And so to you as well, if you'd like to offer a brief introduction to you, the program that you're overseeing, and perhaps how universal basic income could support mothers, particularly right now. Please chime in.
Yeah, no, thank you so much for the introduction, and thank you for facilitating this conversation. I'm Aisha Nyandoro. I'm the Chief Executive Officer of Springboard to Opportunities. Springboard provides programs and services for families that live in federally subsidized affordable housing. We pride ourselves on taking a radically resident-driven approach to our work, which means that every program, every service, every activity that we do is rooted in community. And that is very important to us because the population that we work with being extremely low income individuals who make on average less than $12,000 annually, they are rarely included in conversations about what it is that they need and how it is that they would like to show up to support themselves and their families. And a lot of times the conversations when they are in conversation with folks who are in power, those conversations are based on what it is that you have to do in order to keep your benefits or what you must not do in order to keep your benefits. So for us, being an organization that is grounded in how do we just support is very important to, our mission and our vision for how we execute our work. In this space of cash and benefits and how I really come to this conversation, really about 3 years ago. And Springboard has been operating for 8 years now. I realized that the other day, I was like, ooh, the time flew. But we've been an organization for 8 years now, operating in 12 affordable housing communities in Mississippi, Louisiana, and Alabama. But about 3 years ago, I became really concerned that in spite of all of the amazing programs and services that we were offering, taking a holistic approach, we were not moving the needle on poverty. Families were not exiting the affordable housing communities. Yes, they were feeling more in tune and more optimistic about their future and their kids' academics and those pieces, but we weren't moving the needle on poverty, which was important because that was one of the pieces that our families indicated was important to them. And so, as someone who runs an organization that's radically resident driven, whenever we are perplexed by something, we go out and we have conversations with our residents. And so, we went out and I sat one-on-one and had conversations with folks like I do so often. And instead of couching our conversations in, oh, what is it that you want for your kids? Or what is it that you need to have a better work life? It really was a very simple question. What are we missing? What do you need? And time again, every response was rooted in lack of access to cash. It was lack of access to cash for little things, what we would consider little things, the little foxes, like $25 to pay for your daughter's entry fee into the local science fair because she had matriculated from her school to the next level, to needing to get your car fixed so that you can continue to go to work. And so when we realized that that was the missing component, it led us to dig deeper into what were we missing from a policy lens, from a policy piece, because we know that our families work. The misconception in a lot of instances is that individuals who live in poverty are not working and not working outside the home. So in fact, these families are working 2 and 3 jobs. They are working inside the home as caregivers. They are working outside the home in their jobs where they are not being paid fair wages for their labor. And then in some instances, they are also working as educators because they are having to do the tutoring and the after school programming and the supplementing that so many of us take for granted that we can afford. And so, we realized that individuals were working, but because of the punitive aspect, which we already knew, let's be clear, been doing this work for years, very clear that our social safety net is a mess. I almost cursed. I caught myself. Y'all
You can
it's
curse if you like.
It's a mess, and it's punitive. And so, and what that means is that every time individuals' wages go up, their benefits go down, those pieces. But not only is that problematic, like I said, their wages, especially here in Mississippi, were not meeting what it was that individuals need to sustain themselves and their kids. So in Mississippi, our minimum wage is still $7.25 an hour. If you are a mother raising 2 kids, you cannot live off of that income. On average, our families make about, like I said, about $12,000 annually, and that's including all of their benefits. And so, and recognizing that there was a disconnect between cash coming in the home and policies, we said, okay, how do we fix this? And I am a researcher by training. I don't research in my day-to-day life now. I show up in community, which is fun, but I'm a researcher by training. So whenever it is that I'm, trying to figure something out, like I said, I always lean into research. And that's where we really found the language of a guaranteed income as a platform to allow us to give our residents the resources that they needed in order to go about actualizing the dreams that they have for themselves and their families. So that birthed the Magnolia Mothers Trust. The Magnolia Mothers Trust is the first and only still, even though there are a lot of more individuals getting into the guaranteed income space, we're the first and only guaranteed income work that is centered in a gender racial equity framework and lens, specifically supporting single Black mothers with $1,000 a month for 12 months, no strings attached. We, in essence, double our family's income with these resources. And both Rebecca and Joya have talked extensively about the research as it relates to what we know about cash and how it allows individuals to show up. So I won't go into that because we have more than enough evidence in this country that cash works, that cash without strings work, that individuals show up and they live better lives, they live healthier lives, they're able to execute. So we have enough data. It's really now what we are missing is the will. When COVID first hit, we saw where we gave individuals $1,200. That was 7 months ago. We now have to get back to having those conversations about how we go in supporting families. And the reason that I feel, in this country have such a hard time with giving individuals resources that they need because of the ideal of deservedness. We cannot subtract that from poverty in this country. And we have tied ourselves into that narrative, and it is going to be to our detriment. So I'll pause there. I've said a lot.
It is a lot, but I very much, I could listen to you all day, truly. And so I have a follow-up question, one of many. So why did you specifically focus on mothers? Like, what was the impetus for that?
Yeah, so for us, it's really interesting. So it's a couple of reasons. So in the work that we do, the primary individuals that we work with are mothers. We work in the setting of affordable housing. In that space, our primary demographic are Black women between the ages of 18 and 45 with 2+ kids. But when we were thinking about this work a few years ago, and recognizing if we were going to be bold and innovative, I told my board, we're going to lay it all on the line. If I go out, I'm going to go out down with the boat in flames. And it really was for us to begin to have conversations about what was wrong with, and also conversations about what was needed and how we go about changing the narrative. So in this country, when we look at the data and talk about what's wrong with our social safety net, Black women systematically have been most victimized by our social safety net. And that's because of discrimination, that's because of redlining, that's because of inequity as it relates to wages. On average, Black women make 61% of what white men make. And doing that labor while also still in a lot of instances doing the labor of caregiving and childcare. And so that's one piece of it. But then also when we talk about poor Black women in this country, a lot of individuals really have a narrative that is not affirming. We are still steeped in stereotypes that we have not broken free of since the 80s. And we said, okay, we are going to change those frames. We're going to do a couple of things simultaneously. We're going to give families the money that they need to live. We are going to begin to work and challenge these policies that we know are keeping families poor and are not working on their behalf, and that we're lying to ourselves in order to make us feel good and valued about how we show up, that these policies are actually working when we know that they're not. And we're going to begin to tell affirming stories about what it means to be a Black woman living in poverty, trying to make it in this country. And so for us, that's why it was important to call a thing a thing. I said, if we're going to do it, we're going to call our racism and sexism, because that's what got us here. And, so far so good. I still have my job. So I think it's working.
Well, and one of the things that came to mind in that was also the research that I have read, and I think it was when there was a large NGO push towards microloans for women. And some of the research that was coming out during that time was how much more women put back into their family than men. And I was wondering if that was research that you sort of linked into your thought process, or why you chose to go that direction.
So for us, I'll say, yeah, we thought about that a little bit. For us, really, a lot of our research with thinking about this was the international work, thinking about what should be the amount and the duration of the resources. So we spent a lot of time thinking about that. And we also, just in conversations with our families, we knew that the majority of the resources would go back into investing in themselves, investing in their homes, investing in their kids, which is what we saw overwhelmingly. With our data, I'm not going to do data, no, because Rebecca and Joya got that. With our stories, I can name team moms who, for example, Sierra, one of our moms in our first year of our pilot, and I should say our first year of our work was 20 mothers. We needed to get a proof of concept because of our population that we were working with. No one had ever worked with a population as low income as ours. And no one had ever worked with a population where families have housing vouchers. So there was a concern, and we had to make sure that we would do more good than harm. So our first year, we had 20 mothers so that we could get a proof of concept so that we would have a better understanding of what the loss of benefits would be, but then also making sure that families had a net benefit with the guaranteed income. But anyway, so for that framing. So in our first year, we had Sierra. Sierra completed her GED. Sierra is now in a medical billing and coding program. Sierra got married. Sierra moved into a home. That is, 12 months of post-program. All of that has happened. And Sierra's not the only one. I have a Sierra, I have a Zakia, I have an Arania, I have an Elsie. We like to tell ourselves these stories and make these women have to show up as heroes and lean into the narrative of grit. And they have grit in spades. What they don't have is money. And so we need to quit trying to put them on these pedestals that makes us feel good and just give them the money that they need to live their lives.
Yeah, that's been something that's been showing up in a book that I'm writing right now, and talks about sort of the idea of responsibility, but the other side of that is that it releases, that if you choose to have a family, if you, this whole idea of choice in when it comes to whether you choose to work, and that framing of choice then becomes linked to responsibility. And unfortunately, at least in the United States, that then becomes this, well, if you choose poorly by having a child out of wedlock, not working, when these aren't poor choices at all, then it becomes a way for the government, the patriarchy, for lack of a better word, and even people in extended family and their own families to say, well, you just chose badly, so we don't have to do anything about it, when that's not the case at all. And I mean, I of course do respect the grit of so many people that are enduring poverty, but to have that as the sort of baseline of what needs to be there in order to somehow think that this person is it should be entitled to the same rights and human dignity that the rest of us have seems erroneous, to say the least.
Exactly.
So I have one more question, and well, I have several questions, but I did want to open it up. So if other people are thinking of questions that they would like to, or comments, add to the conversation, please make free use of the chat box. You can, I think, choose to, address a single person, but you can also choose everybody. And then there's also the Q&A box. So either one of those is a perfectly acceptable way to add thoughts or questions. I'd love to hear from the many people who have shown up today. I'm excited for that. But people are kind of thinking, I always hate being on the spot. So I'm going to throw one more question out. We recently had, IMS had their annual conference, and we had a great conversation with two nonprofit leaders. One was from New Moms and one was from Health Connect One. And a large part of our conversation addressed how to make that bridge between academia and activism stronger. I think likely Joya and Rebecca, I don't know where you put yourselves on the activist scale. Some people sort of consider their academic work to be their activism, or if you have outside work that you consider to be activist driven. But obviously, Aisha, you're an amazing example of building that bridge as a woman of one. But how do you think as academics and as nonprofit leaders, we can sort of work together more symbiotically so that our work has more impact, but also that those that need our work are receiving the skill sets that they need to be better self-advocates and, kind of get the funding that they may need or whatever it may be. Like, how do you see that playing out? And that could be for anybody.
I can start us off on that. So I've had sort of a strange career where I've moved between the community sector, the research sector, and the policy sector, kind of back and forth over time. Whenever I get frustrated with one, I jump into which happens a lot. But really, like what drove me to a lot of these issues is I started my career as a community health practitioner, and as Aisha spoke to, you know, when you're on the ground, all you see is gaps in these systems, and you see that the social welfare net we have, and I'm in Canada, where we are lucky to have a few more protections, but where it's still a very, very leaky net, and it's punitive. It is time consuming. It's incredibly time consuming to access all of these benefits in such a way that just creates an icy slope for people. There's just no way out. And so, you know, a lot of my academic research is driven by trying to figure out what are those steps that would actually let people be able to build a better life for themselves. And as a public health researcher, that allows them to be healthy and to be well. And that's really what led me to guaranteed income. That, you know, I think, again, my policy experience just shows me that we have not built systems that work for the current reality of work. Work doesn't pay enough if you are in the labor sector. We've completely undervalued the work that happens outside of the formal labor market. And so I very much see myself, I suppose, as an activist, and that's really driven me towards work that tries to directly connect with practitioners. That's some of the work we're doing at the lab, is to try and bring researchers together with people who are running experiments on the ground or who are in community organizations, so that it's equipping them with the numbers they need, because those can be compelling to advocate for some of these changes.
So what would you say are some of your frustrations that you would like to see turned around into, well, I shouldn't say frustrations turned around, but what in the system would you like to see changed so that you're less frustrated, I should say?
So I think we do need to move towards some type of policy solution. You know, we've I think even in this call referenced that as a few different things: a basic income, a guaranteed income, potentially a negative income tax, which is actually what Canada experimented with in an Ontario pilot that was very unfortunately canceled, that guarantees an income floor. So I think at the most basic level, when you break guaranteed income down, there's a guarantee. So we're collectively saying that you're valued outside of your position in the labor market, and income, that there's a floor that we're going to agree that nobody should fall through, that we decide that there's a number at which you need to be able to meet your essential needs, and that's something that we should provide to everyone. I think within those two concepts, that there's lots of different policy options about how you fund that, how you phase people in, whether people get phased out, but that I think a lot of the gaps in the system could be addressed by moving more towards that direction.
Joya or Aisha, did you want to chime in?
I'll pipe in on the activism front. I absolutely do see myself as a feminist and an activist. Although I forgot to introduce myself, I'm a professor of public policy and sociology at UMass Amherst. I'm also the immediate past vice president of the American Sociological Association. So I have a chance from this kind of seat in academia to make connections out to the real world. And I think that what we need is a completely different structure. Right now, academics tend to do the research that they think will make a difference, but we're often not connected to the people on the ground who can say, this is the evidence we need. These are the arguments we want to make. Can you collect evidence for us? One thing that I was involved in was trying to get a feminist organization to support sabbaticals that would have us seated in nonprofits. So take a year and really work with that nonprofit. And I do think that that can drive a scholarly agenda in very positive ways. I failed to get that funding, but it's still something that I'm thinking a lot about, that we know that these relationships have to be sort of going both ways, rather than one person saying, I'm going to do this, you know, and the other person just having to deal with it. So I think of, you know, what this organization does is helps bring us together, helps bridge some of that. I do wish that I had the feet on the ground that Aisha has, but I think having a respectful partnership helps create at least the possibility.
Aisha, did you want to chime in too? I know that one of the things that came up in the talk that I just referenced was exactly what Joya was saying, is that, this sort of scholars and activists saying, this is the work I want to do. Hey, you all, you figure it out on how it's going to be useful to you, rather than actually having that conversation ahead of time and responding to the needs with one's own research. But one of the other things that came up in that talk was this idea that there's really almost kind of a sense of antagonism, and in part, I think, because of that lack of listening and lack of respect of people that are really doing the work. But also that's sort of, and I think those of us who have been through academia can admit that, oftentimes those that are in academia fall prey to that valuing formal education over informal education. So how do you see some of that playing out with the work that you do, Aisha?
Oh gosh, that was a lot.
I'm sorry. Like I said, I have so many thoughts going through my head on this.
It's interesting because I was like, I don't see, I will honestly say, this is going to sound crazy, but I don't see that playing out in my work. And that's because of the positional power that I have. And so as far as where I sit, I don't see myself as a activist or a scholar. I see myself as a community member. And I see myself as wanting to be a good community member. And as a good community member, it really is, how do I leverage all of my networks, all of my areas of expertise, and how do I show up in what space is needed in that time. So, when you introduced me, Katie, you call me Dr. Nyandoro. I am never called Dr. Nyandoro. I don't even know if the residents that we work with know that I have a PhD because it's not important, So in being a good community member, it's really, how do I show up in that moment, what's necessary. And so it's just not necessary. But then also, in being a good community member, for me, it's really, how do I protect our community and our community members and the relationships that we consider so sacred? Because, I tell folks all the time, the reason that Springboard to Opportunities works is because of the trusted relationships that we have. It's not because of the model. It's not because of the programs. It's really because we take the time to establish those relationships and be a good friend. And when you have that, when you do that work and you have that trust, there is a social contract that you have where you have to show up for your friends. So, when individuals come in and want to have research relationships with us, there is a lot of vetting that happens on the front end before those relationships are accepted, or I hate to say allowed to happen, but before those relationships are allowed to happen, because unfortunately, and sometimes academia does not recognize the long haul of the work. It's those relationships are extractive. It is someone trying to get their research paper done, trying to get their PhD done, trying to get whatever done. They come in, they take the work, they're gone. And in the communities that we work in, that a lot of times academia needs for their research, those communities are so vulnerable. The extractive relationships where you're taking other individuals' expertise without giving them credit, without giving them the resources for their wisdom. I do think that is a space where academia could do better. So whatever that looks like, y'all, if y'all got positional power like that, do that. But otherwise, for, like I say, for me, it's understanding the seat that I have and the position that I have, and taking that, being very respectful of that responsibility, because I do know that it is a trusted responsibility that I don't want to mess up.
So one of the things that I've been thinking about through this, and coming from obviously a maternal activist lens, some of my kind of political push and weight has been behind not necessarily even moving to universal basic income, and not that I disagree with it, but at least respecting the care work that's being done. Whether it's for elders or for young people or with people that have special needs. How do you think that might enter into the conversation? Do you think that having some sort of, I mean, certainly we see that throughout many countries in Europe, that there's some sort of reimbursement for people that are doing in-home care and kin care work. Do you think that that would be something that would be easier to kind of get through the proper channels than universal basic income? Or do we just kind of go with the big ask and say, this is what we're kind of orienting around?
Well, one thing that we know is that in the late 60s, early 70s, we almost got the family assistance program. And there was a lot of widespread bipartisan support for something like universal basic income. So I think it's always a big surprise that we've flirted with this idea before. I think that Andrew Yang in his campaign really made clear that there's good evidence for how this works. I do think in policy circles, there's a sense that it'll be easier to get motion on paid care. And the notion there is that if it's care for elders, disabled, as well as children, everybody can see themselves as benefiting. And therefore, it's something that's like an easier, more popular shift. I personally think that paid leaves are critical, but childcare has a stronger impact, and basic income has a really powerful anti-poverty impact. So I'd like all of them to be in the mix.
So I want to respect everybody's time here. And unfortunately, we're closing in. So I have one last question. And it's the question that those of you who have tuned into past talks probably know is already coming. But that is, IMOS, our middle initial is action. And I do think that that's something that is oftentimes left out of the equation in these sorts of talks. So what is something that you think, whether people are listening or just sort of your communities in general, however you want to frame that, what's an action item that people could take on that would help support women and women's work and mothers' work, or getting UBI through, or any of those things? Like, where do you see something that people can engage with in that way and have something that they can commit to as an action step?
Vote. Put on your PPE and go vote.
Voting is, yes, I think probably most of us are very committed to the election process at this point. I know I have been writing postcards until my hand is weary, and doing everything that I can to make sure that we get the politicians that we know will support these ideas into office. We are a 501c3, so I cannot add to that, but
not add to it either. That's why I just said vote, period.
vote for the people that are going to pay attention to these issues. Absolutely. Joya?
I would just say telling your story as well to your legislators at the federal and at the state level. I think that many people who go into public service wants to make a difference, and connecting to their people and recognizing what a big difference they can make through these policies. That's really useful. Voting is critical. We have to vote as well. But I think that communicating about what we need is sensible. The reason I do the research I do, it's cross-national, is to provide evidence to US legislators of what the best policies they could possibly adopt are, but they won't do that unless they think that their people need them.
And so a quick plug, sorry to chime in here before you go, Rebecca, but we do have our IMOS postcards. And so if you go to our website, then you can go under get involved, and there's a very easy link. We are not going to spam you. We're not going to do anything. We're simply going to send you your postcards. You do the postage. You write your personal story, as Joya was talking about what you need your politicians to do for you. Unfortunately, this is a US-based effort right now, but we are hoping that somebody from Canada Rebecca, wants to take over the Canadian offshoot of this, because we certainly are not trying to leave anybody out. But right now it is a US-based effort. So Rebecca, you have our closing thoughts here on
Oh, wow.
action steps.
Well, I don't know that I can beat vote. I'm not allowed to do that in your country. So I'm hoping that everyone I know are
Useful in your country too. I mean, that's partly how you got to have politicians that you have.
Absolutely. So I guess to build on those ideas, I think that it's possible sometimes with social welfare policies to think about them as something for someone else, depending on what our own social position and kind of social location is. But I think what's important is to see the economic security for everyone, and economic security that provides flexibility and dignity to people to be able to more fully participate in their communities, to be able to more fully participate in caregiving roles in the multiple forms that that takes actually benefits everyone. So to put that a bit differently, I think we need to see that there's links that these types of policies have beyond individuals who are directly targeted, that it's not for someone else, it's for all of us. And that when everyone can fully participate in communities, that makes motherhood more sustainable for everyone.
I couldn't agree more, of course. Thank you to all of you for your time, your wisdom, your insight, your advice, everything like that. We will hopefully have a recording of this. Missing the first 5 minutes. Apologies again for that. But thank you to everybody in the audience who joined us today. But certainly, keep fighting on. I think these are incredibly important issues that are getting more attention due to the voices that you add. And I know that everybody here is very appreciative of the work that you do. Thank you so much.
Thank you so much. It was such a
Thank
pleasure.
you, Katie.
I could have
Thank
this
you, Katie.
for hours. Thanks, Katie.